Good morning. I'm Jessica Lovell. Welcome to the Morning Medical Update. Today, we will share the story of a young woman who wanted to start a family, but breast cancer made fertility complicated. We'll meet her and her doctor here in just a few moments. But first, in today's morning rounds, we follow up on an announcement made late yesterday involving the University of Kansas Health System and Liberty Hospital. The Liberty Hospital Board of Trustees voted to pursue a long-term partnership with the University of Kansas Health System. And to help us understand what that really means, we are joined virtually by Liberty Hospital President and CEO, Dr. Raghu Adiga. And here in studio with us are our President and CEO, Bob Page, and the President of the Kansas City Division, Tammy Peterman. Welcome to you.
Great. Thanks.
Dr. Adiga, good morning. Tell us a little bit about how Liberty made the decision to partner with the University of Kansas Health System.
Thank you for having me. We put this process in place over the past several months looking for the right partner. And of course, we found the right partner right here in Kansas City-based University of Kansas Health System, who is a world-class healthcare organization that can bring all the services here, and we have common goals in place, looking for putting the patients first and bringing high quality care right to patients' home. This was an exact match that we were looking for.
So Tammy, what's happening exactly in the marketplace that is leading to these types of partnerships?
Sure, great question. And certainly as we look across the country, there are a lot of changes in the healthcare environment right now. There's certainly changes from an economics perspective, but there's also changes happening with some consolidation and people looking to partner with other organizations. And particularly mid-sized and smaller organizations are looking at opportunities to work with larger health systems for a lot of reasons. As Dr. Adiga just talked about, there are reasons from a clinical perspective and making sure that you're aligned from a clinical and patient safety and quality perspective, adding additional resources and support. And I think there's benefit and there's scale. All of those things make it attractive for both larger academic medical centers like us to partner with other organizations, and certainly for other organizations that are a bit smaller to look to partner with larger organizations. It's happening across the country. It's happening across our region as well.
So Bob, how does this fit into our plan for growth?
Well, first, I just want to say how excited we are. I mean, this is just an unbelievable opportunity, not only for the health system, but also for Liberty and for our community. In terms of fitting into our growth plans, first, I think it's important for people to understand that 35% of our patient population comes from Missouri today. So it's not like we haven't taken care of Missourians. We've always taken care of Missourians. And when you look at growth and you think about what Tammy talked about, the importance of scale, we're also very selective in our growth. So the first thing we look at is cultural compatibility with potential partners. That's what we found with Liberty. That's what we found with Olathe Health. And so if you think about it, it's not growth for growth's sake, but rather it's growth with the appropriate partners, always putting the patient at the center of those decisions. That's what we did here with Liberty. That's what makes this so exciting.
So we announced that we're pursuing a partnership. What is the next step in that kind of process?
Well, now you get into legalese, right? The next step is actually a letter of intent. And so we will take the next week or two to finalize a letter of intent. That then will allow us to get into deep dives around due diligence. We'll learn much more about each other, and that will then allow us to get to final agreements. We would imagine that'll take several months for us to get that done, but clearly the next step will be a letter of intent, and we should probably have that done within the next week or two.
Really exciting time. Dr. Adiga, what message do you have for patients at Liberty Hospital right now?
Well, for now, nothing is going to change for our patients. All the high-quality services that they're getting will continue, and they can look forward to even enhancing those in bringing in world-class specialists to local care is what they can look forward to. So we are all, as Bob said, we are all very excited here for this partnership to continue to grow the healthcare in the Northland and Northwest Missouri.
So Tammy, similar question. What does it mean for patients, but also employees at the health system?
Sure, and as Dr. Adiga just said, there's no change in what we're doing with our patients on this campus and in any of our campuses and throughout our entire system. We're going to, right now, do what we've always done, which is provide great care and support to patients and their families. That's what we do every day. It's what we're going to do in the next number of days. That's what we're always going to do. When we talk about employees, there's nothing they need to do except continue to provide the absolute very best care for our patients and take care of our patients, take care of their families. We're going to continue to do that. I think there will be opportunities for us to continue to update our staff, our medical staff, certainly across our system as well as in Liberty. But right now, I think we should be excited about what's happening. I think this is great for Liberty. I think it's great for our health system. I absolutely believe this is great for our community as well.
All right, I want to take a moment to see if there are any reporters on the line with us. So now is the time, reporters, to unmute, say your name, your outlet, and then ask your question. We're going to just give you a few moments here. All right, Bob, Tammy, thank you so much for joining us this morning after this big announcement from yesterday. So good to see you today.
Great.
And Dr. Adiga, thank you so much for joining us. We appreciate it.
Great, thanks.
Thank you.
Thank you for having me.
You bet, you bet. Turning to today's story, in 2019, Libby Sinovic had just married and was ready to start a family. Janine Kiesling shows us how it was still possible even after her cancer diagnosis.
Libby's mother, Kathy, knew she had a mutation of the ATM gene that increases the chance of getting breast cancer. Libby hadn't been tested yet, but was already part of a proactive program here at the University of Kansas Cancer Center. That included bi-yearly screenings. Because of the family history, Libby and her team of doctors wanted to be aggressive with her treatment. So a new plan to expand their family was hatched.
I'll never forget it. It's life-changing. I mean, I called my husband. Like, it's hard to even say that out loud, you know, because it's just news you were just no one's ever prepared for.
A breast cancer diagnosis for newlywed Libby Sinovic was devastating. At 32, she and her husband planned to start a family right away, but Libby knew her health had to come first. Still, she didn't want to give up on her dream of one day being a mother. Fortunately, Libby was already part of a breast cancer prevention program, which includes bi-yearly screenings. And once she was diagnosed, doctors were ready with a plan.
From diagnosis, you know, that next day, I think I was in the office with my oncologist coming up with a plan, and the day after that, I was meeting with the reproductive endocrinologist. So from finding out that I had cancer to putting a plan in place, it happened so fast, which was great.
Libby and her doctors decided IVF treatments to harvest Libby's eggs was the best option. She had time for one round before she underwent a successful double mastectomy, after which time she underwent 18 months of anti-hormone therapy. Last summer, Libby was taken off the drugs to see if her body would accept an embryo transfer.
And then we did the embryo transfer August 18th of 2022 and found out we were pregnant on August 30th of 2022. Oh, I know.
Josephine Sinovic was born on May 4th. Josephine does not have the ATM mutation.
Adam and I, Adam's my husband, we joke all the time like we should have named our firstborn after Dr. Nye and Dr. Marsh. They're incredible. The care we received, it makes me emotional because I just always felt like we were such a priority. I always felt like we were heard. Dr. Marsh, when it came to the fertility stuff, just went above and beyond. I just trust them, obviously, with my life.
And we are joined now by Libby and Dr. Courtney Marsh here in studio with us. Dr. Marsh is a reproductive endocrinologist and fertility specialist who helped Libby on her journey to motherhood. So, Dr. Marsh, good to see you.
Thank you.
Libby, how are you?
Good morning. I'm good, thanks.
How's little Josephine doing?
She's amazing. Gosh, she's 5.5 months now. So I just went back to work a couple weeks ago and she's starting daycare. So working through all of those new things, but she's wonderful.
Dr. Marsh, what's it like seeing a baby that you helped create?
Oh, it's the best thing. It's the reason I do what I do.
I think I've shared the story that I've gone through IVF before as well. And there was something about being able to take the baby to the doctor and said, see what you did? This is what you did. So it must feel really good.
Oh, yes, the best thing.
It's like, yeah, it's a big proud moment for mom and for doctor. Libby, when we spoke to you before, you said that a cancer diagnosis lives with you forever. It's not something you can put in the rearview mirror. So how are you feeling and what is the status of your cancer now?
I mean, I consider myself cancer free. I've, when my cancer was caught so early, so through surgery and chemo, we were really confident that there's no more evidence of disease. Physically, I'm feeling great. Mentally, it's always a little bit of a struggle. Some days are harder than others, but we really feel, especially having gotten through this pregnancy journey, like we're on the other side of a lot of it, and that's a great feeling.
So Libby, at what point in your cancer diagnosis and treatment plan was the idea of fertility preservation even brought up? Was that pretty soon on?
Yeah, it was immediate. Like the story said, we'd only been married for 3 months. We really, we wanted to start a family right away. And so that was probably the most devastating news to digest, is that we would have to put all of that on hold. So we started talking about that at the very beginning. And we were seeing Dr. Marsh, on day 2 or 3 of knowing about my diagnosis. And we were, I think, starting shots like day 4 or 5 after hearing about my diagnosis to start that egg retrieval process. So it was immediate. It was never not part of the discussion.
Dr. Marsh, I can't imagine what those conversations are like, because somebody going through cancer, hard to even imagine that. And now you're having to think so far into the future, and now you're dealing with family planning, another challenging time of life. What are those conversations like with patients like Libby?
I mean, it's so overwhelming. I mean, you're seeing so many doctors at once and getting so much information. So we really try to just focus on getting through the process and helping a team get someone through it, because it's a lot to digest.
So treatment, as we mentioned, she was starting to get those shots, and this was happening so fast. Why is time of the essence in this moment?
Yeah, it's about a 2-week process to freeze eggs, and so sometimes people have that amount of time and sometimes they don't, depending on their diagnosis. So speed does matter.
So what is the best way to save embryos and eggs and sperm ahead of cancer treatment? Kind of take us inside your world and tell us exactly what's happening.
Yeah. So embryos are the best if you have a partner or a sperm source, but if not, eggs are also not experimental anymore, so freezing eggs is also a great option.
So let's talk about what happens during egg retrieval, and just maybe give us a little bit of the timeline of when that happens and when it happens again with somebody who's been diagnosed with cancer.
Yeah, it's usually a pretty quick start of getting your medicine starting, doing 10 days of shots, and then usually 2 days later you'll do the egg retrieval. It's an outpatient procedure and it's under anesthesia, but it is pretty minimally invasive and a safe procedure.
Libby, is that how you remember it? What was retrieval day like for you?
I think when it was all said and done, I did like 5 rounds of IVF. So it was always nerve-wracking, just because the process to get to the retrieval day is mentally and physically pretty taxing. The way everybody's body responds, I'm sure, is different, but you start to get pretty uncomfortable towards the end, and you're doing shots every day. And so the pressure of that egg retrieval going well is high, because you've taken so many steps up to that point to make it happen. So always a little anxiety ridden, but again, I've said it a number of times, the care we received, the compassion and whatnot was just incredible. So we always, as soon as we would get there and get settled, we would always kind of have a sense of calm and trust that our providers were going to do everything they could to help us out with getting our family.
Well, anxiety, as you mentioned, but also family planning can be exciting. So you're trying to find this balance, the health of your future baby, but of course your health. How were you keeping those two things separate while you were going through this, or were you even able to do that?
Gosh, maybe I wasn't able to do that if I can't think of how I did it. I think in the front of my mind at all times was just doing what I had to do to be able to have this family. So I think I'm probably still processing a lot of it, to be honest, but I think when you're in the moment, you just are doing what you've got to do and what your smart doctors are telling you to do to make it all happen.
Yeah, and being so-called cancer-free or no evidence of disease at this point. You have little baby Josephine. It must be like a whirlwind moment of realizing from where you were to where you are now. I want to ask Dr. Marsh, so again, take us through that process. The eggs are frozen. How long do they stay frozen? And what's kind of the next step?
Yeah.
Kind of take us into that. It's very sciencey back in there.
Yeah.
So show us what's going on in that room and how you're doing all this.
Well, in Libby's case, we made embryos. So we retrieved the eggs and we fertilize them with the sperm, and then we grow them for about a week, and then we freeze them and do genetic testing, and then can use them whenever you're ready.
Very exciting. So how long after being declared no evidence of disease could you start the implantation, the transfer, the embryo transfer?
Yeah, that's totally dependent on the oncology team. So they tell us, and they're leading the ship there.
Okay, so Libby, was your future transfer and implantation, was that on your mind during your cancer treatment? How are you staying focused on you, but also, again, your future family?
Yeah, I think we knew it was going to be a little bit of a long road before we could get there. So I think when I was in cancer treatment, I was just focused on that. And then once we were able to, there's still, just because I was so young at my diagnosis, and there's not a lot of data or studies about young women, breast cancer survivors, coming off of their anti-hormone regimen within that first 5 years to conceive. There's not a lot of data that says this is safe. I think there's an ongoing study, but not results from that yet. So Dr. Nye, my oncologist, felt comfortable, after 18 months of that anti-hormone regimen, that I could then come off and start thinking about trying to conceive. So I think I just kind of flipped the switch when it was time to be done with the cancer treatment and move on to the fertility process.
Typical female answer. Flip the switch. Just do what you got to do. She's like on a mission, on a huge mission. Yeah. So on a bigger picture, Dr. Marsh, just what's really exciting as far as the future of fertility treatment goes?
Yeah, it is exciting. I mean, the field has moved so fast and we've come so far, and they're even talking now about taking skin cells or stem cells and making sperm and eggs. And so, maybe in the future we're not even going to have to do this retrieval process. So very exciting.
Very exciting. And for you to be kind of right here in the forefront.
Yes, absolutely.
Ready to take it on.
Yes.
Be sure to ask your questions. Nothing's off limits. You can use the chat on YouTube or Facebook. You can tweet us or email the Medical News Network. Info is right there on your screen. Let's check in with Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control. Happy Friday.
Hi, yeah, I'm glad it's Friday, for sure. Right now we have 20 active patients in the hospital with COVID, so the number has kind of stayed steady, like we said, in those higher teens to 20. We'll see what happens next week. Hopefully it's going down. We know still the virus is out there. Not a lot of activity of influenza in the community just yet, so that's a good thing. If you have time to go get your vaccine, now's a good time to go get it.
I got my flu shot.
Yeah, I'm getting mine soon.
Okay, good. All right, there was I have to ask you about this, new paper published regarding COVID and when people start to feel the symptoms. Researchers argued that taking a COVID test on the first day of symptoms might give you a false positive, and that PCR test might not show positive until several days after symptoms start. So what do you make of that, and how is that different from before? Is it?
Yeah, it was a false negative.
Gotcha.
And this is an article, a published article that supports what we have been saying, and that is, if you have symptoms, take a test. If it's negative, take one the next day or 48 hours later. So this really supports that. And the reason for this is people start to get symptoms now because they've had exposure to the virus or the vaccine before. So it's really that immune response. When you see that virus, your body kicks in much quicker because it's had exposure before, either with vaccine or previous infection. And this study was done from April 2022 to April 2023. Over 90% of people had either been vaccinated or infected or both. So they had an immune response at that point. They started having symptoms. They tested with PCR. They were PCR positive, which is much more sensitive than those home tests that we have, those antigen tests. So that then says, okay, well, if you're negative on the first day, check 48 hours later and maybe even later than that. There was a study published a year or two ago that also supported that and said that really the peak sensitivity of those home antigen tests is probably about by day 4 of symptoms, and that's about 75 to 80%. So this is really similar in those results. And it just goes to continue to support the fact that if you have symptoms, test early. If you're negative, you're probably going to want to test 48 hours later or 72 hours later to get a more accurate answer and tell you if you have COVID or not. So again, I think this is not surprising and just supports currently what we already know and supports the information, the recommendations we've been giving about testing at home.
I have a question for you. I went to my kid's school lobby the other day waiting for him to come out, and they had like a basket of COVID tests. And of course it said, here's the dates and make sure you check, but that it's an extended time that they'll be expired. Just give me a little quick brief, 101 on that, as far as what am I supposed to be looking for as if we get kind of stocked up on tests and them being expired.
Yeah, I think that is important because before it was very difficult to go find tests. Now there is probably a glut, so you are able to go get them really on demand when you want them. And of course, the government had that program recently, I don't know if it's still going on, where you could order home tests as well. But the important thing to do, also understand, is that you may not have symptoms or COVID within that time or soon after you get those tests. So it's important to understand that, really all medical equipment, testing, drugs, therapeutics have expiration dates on them. But for this, it is very important to check those tests. And then a lot of those companies will have websites that you can go to or QR codes that you can scan and you can say or look to see if that expiration date has been extended. And really that is just to help increase the life of those tests, but also make sure that when you are doing the tests, you can be confident that the answer is accurate that you are able to get.
All right, Hawk, thanks so much. Let's get to some questions from our viewers today. And Lynn wants to know, what if there isn't a sperm donor available right away? Let's just say you're not married or you don't know where that sperm's going to come from. How long can the egg stay on the shelf, so to speak? And is there a storage fee?
No shelf life. Yeah,
no shelf life.
They do not expire. So different than a COVID test.
Exactly.
There.
That's what we like to see. No expiration
Eggs
date.
are better than COVID. No.
But how is that so? I mean, we think about that. An egg is just like this sacred thing that you're trying to bring to life, and now you're saying nope, it's good. It can handle it.
Yeah, we've gotten better and better at freezing. We used to slow freeze them, and now we vitrify them, which is a fast freeze, and they survive better. So we do not have a shelf life. There's been children born after embryos being frozen for 30 years.
Wow.
Yeah.
Okay, I have both of my kids were frozen embryos. Yeah. But not 30 years, but yes, but still. But in that case, they actually said that the frozen embryo was actually a better option for me than doing it fresh.
Yeah.
So, and you'll hear that a lot with fertility treatments, fresh versus frozen.
Absolutely.
But so question is it possible that cancer treatment would not have damaged Libby's reproductive organs or damaged the eggs? This is all just preventative in the event that it could?
Absolutely. So, everyone's journey is different with their cancer process, and everyone gets different treatment. So you do want to consult your medical team. But it's an insurance policy, so there is possibility that it could be damaged, and so this kind of acts as an insurance that you could have something in the bank.
So what if somebody changes their mind? Let's say they get diagnosed with cancer, such an awful time. They're presented with this option, or maybe they weren't presented with the option. Who knows? And then they go through the treatment. They're cancer-free. They want to start a family. What advice do you have for them?
Yeah, everyone's different. Sometimes it goes so fast and you can't freeze, or they didn't get the advice. And sometimes you're still able to build your family on your own, or sometimes you need more advanced things like adopting embryos or using someone else's eggs.
Okay, so what is considered a good amount of eggs to retrieve? We mentioned, I think Libby, you said you did 5 retrievals. Is that what you had mentioned that you had done?
I did.
Yeah, so what's a good amount?
Yeah.
Any would be good.
Yes. And it varies depending on the person, but we would say that you would want to get at least 4 to 6 eggs to make it a good freeze.
So do you have to decide, here's a question from someone, do you have to decide the amount of kids you want before starting the fertility process?
I mean, it does help. If you're telling me you want 5, 6 kids, then we're probably not going to do well with 2 eggs.
Okay, yeah, that makes sense.
The math makes sense there.
So then it's a numbers game.
Yes.
I mean, it's a numbers game, and more retrievals make sense. Question for you, Libby, just what advice do you have for somebody going through this journey, or who maybe has not yet been confronted with this particular path? What kind of advice would you have for them?
If it is something that you have the opportunity to do, while it's a very rigorous process, it was 100% worth it for my husband and I. I don't think we would have been able to create a family any other way, and so it's worth it. I think I said this last week about the cancer journey. It's all very daunting up front, but I think everybody can surprise themselves on what they can handle and what they can get through. And it's a weird thing to say, like, I recommend it, but I highly recommend it because we have a beautiful, healthy baby thanks to it.
That's right. In the end, you have this chance to have a pretty baby Josephine. So very exciting. It's worth it. Okay, so Paul wants to know, how can you know if you've had COVID? Is there a reliable test to know if you've had COVID?
Yeah, there is a reliable test. It's an antibody test, but you have to make sure that it's the correct antibody test. So most of the antibody tests that are around test for spike, looking for spike. That will not tell you if you had COVID. That will tell you if you had either COVID or exposure to the vaccine. The antibody test that tells you if you've actually had exposure to the virus is to the N antibody, which is another part of the virus that your body makes antibodies to. This is not present in the vaccine, and the only way you can have evidence of it with the antibodies is if you actually had infection with the virus. So some of the local labs around town do offer that testing, but it is important to make sure that you are testing for the N antibody, not the spike antibody.
All right, Huck, I'm going to stay with you because we're going to get today's takeaways as we head into the weekend. What do you want folks to take away?
Everybody be safe. Like we said, there's low influenza activity right now. It's a perfect time to go get your influenza vaccine. If you're over 60, get the RSV vaccine, and certainly try to get that updated COVID vaccine as well. Hopefully it'll be nice weather and everybody can get outside and enjoy it as well.
All right. Dr. Marsh, what's the takeaway today?
I mean, if you have a cancer diagnosis, please see a fertility specialist. We can help, and I know it's overwhelming, but we do build families, and it can work.
Great. Always good to see you.
Thank you.
Thanks so much. Libby, what do you want folks to take away from your story?
I would echo what Dr. Marsh said. Just know your options up front and don't be afraid to, take that hard step to go down this journey and preserve your fertility so that you can have a family when it's safe. 100% worth it. And if you're in the area, work with Dr. Marsh. She's amazing. She's our angel. So
love that. That's got to be good to hear.
Yes.
That's got to be the angel. Okay, so let's, Libby, just again, thank you so much for sharing your story. We can't tell these stories without you. So, all right, thanks to all of our guests and to our viewers for being with us today. Of course, today is Red Friday. Last week, the Chiefs partnered with the University of Kansas Health System for their crucial catch game, of course, dedicated to raising awareness for cancer screenings. And we're going to leave you today with a look back at that event.
Against cancer. Joining us on the field are our 7 survivors and their doctors from the University of Kansas Cancer Center that represent all 7 screenable cancers.
Coming up Monday on the Morning Medical Update, mammograms alone aren't good enough for women with dense breasts. It takes more to spot cancer. I'm Jessica Lovell. On the next Morning Medical Update, we inform and empower women and walk through the extra care needed for those with dense breasts. Monday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now, everywhere podcasts are available.